what are the natural effective remedies for a second-degree burn? A second-degree burn. Now, a few days ago, we talked about first-degree burn and some of the natural remedies that you can use. Now, for a second-degree burn, some of the things that we do are quite different from what we do for a first-degree burn. So let's dive into it. And before we talk about the natural remedies, let's talk about what are the hallmarks of a second-degree burn. A second-degree burn affects both the outer layer and also the inner layer of your skin. The outer layer is called the epidermis and the inner layer is called the dermis. Now, the inner layer of your skin contains blood vessels, nerve endings, oil glands, and contains blood vessels, and it contains also other connective tissues. Hair follicles are embedded in the inner layer of your skin. So when you have a second-degree burn, that area is also affected. So the symptoms are different. What are the hallmarks of a second-degree burn? The first one is intense pain. Now, because of the nerve endings that are affected, you have very, very intense pain. So if you burn with very excruciating pain, that might be a hallmark of a second-degree burn. Another one is that it's a deep redness. The affected area often appears very intensely red, very red, as different from the first-degree burn when you have just a little bit of redness. It's an intense, deep redness of the area. And also you have formation of blisters. Blisters are one of the hallmarks of a second-degree burn. And also, most of the blisters are filled with fluid. Okay, so when you have that, that means you're looking at a second-degree burn. And also, it has a wet and a glossy appearance. So the burn area may look very wet or shiny due to the leakage of the fluid that is coming from the inner layer. So it looks very glossy and very shiny. And also there is intense swelling of the area. In fact, there's significant swelling of the area where the burn is. So if you have all these, that means you have a second-degree burn. The last hallmark is there's a blanching with pressure. When you touch the area, you push the area where you have the burn, it's blanches. When you remove your hand, it becomes red again. So if you have these signs, then you have a second-degree burn. What is the first thing that you want to do if you have a second-degree burn? Of course, you should remove the clothes or any jewelry in the area where you have the burn. That is the first thing you want to do. And the second thing that you want to do is to run cool water over the place. Immediately run a running water over the area where you have the burn, and this is going to reduce inflammation, going to reduce swelling, and also reduce pain. Now, do not put ice on the burn area, and do not put cold water from the fridge. It must be a running tap water. And it's cool to run it over the area. This is very important. If you put ice on it, it's going to make the burn worse. And so after you've done that, the second thing you want to do is to apply aloe vera gel. Aloe vera gel. In fact, aloe vera has been shown to decrease pain. It has an anti-inflammatory property, so it will decrease the pain, and also it has a healing property to speed up healing. There is a substance in aloe vera that will speed up the healing process for you. Now, after you put some aloe vera on the area, the next thing you want to do is to do cool compresses. So take a clean wet cloth and just put it in water, and after it cools down, put it in the area where you have the burn. That is going to relieve pain and also reduce swelling. Like I said before, do not put Vaseline, toothpaste, butter, ice on the area. So when you do this, you start having some relief from the pain that most people experience, in fact, with a second-degree burn. Now, most second-degree burns will heal by 2 to 3 weeks. They should heal second-degree burns. However, if you've done all the above at home and you are still having severe pain, or the burn is over an area which is about 3 inches wide in diameter, and you're just not improving, or you're having just increasing redness and swelling, or the redness is going up the area, it's getting bigger, or you are developing a fever, or there is a fast swelling of the area where you have the burn, or the burn is in areas like the face, the hand, the genital area, the buttocks, or over a joint. Okay, if you have burns in these areas, that is considered very serious, and home remedies will not work. You should go in to the emergency department directly to see a physician. Now, also, if it's a child less than 5 years old, or an adult over 70 years old has a burn of any form, it's good to go to see a physician immediately, because the chance of complication is very, very, very high. So this is how you treat second degree burn, different from how you would treat a first degree burn. So if you experience any of these, please apply this home remedies first and see if you get improvement. If it doesn't, and you're having the signs that I just listed above, then you should go in and see a doctor right away. So if this video has been very helpful to you, you've learned something new, I want you to subscribe to my channel and also leave me a comment. If you applied any of these things that I've shown to you and it's been very helpful, share with our audience so that they can also learn from it in case any of their family members or they themselves experience a burn. Until then, remember that you are your own physician these days. So take this information and apply it. Until then, I say this is Dr. Moses. You stay well.